COVID. He was only sick for 6 days and had just a sniffle for the first 5, and then was suddenly so sick that he couldn't maintain his oxygen, and he was too weak to move in bed. And he died the next day. So in his memory, I'm kind of committed to do whatever I can to fight COVID, and that's how this program was born. So I'm going to introduce our panel, and they have great information to share with you. First of all, we have Mark Sandock. You want to wave, Mark? Dr. Mark Sandock is an internist, and he practices in Mishawaka, or is retired but still practicing some. We have Bill Sarnat, who is a cardiologist, also has practiced in Mishawaka for many years. And we have Chana Blatt. Wave Chana. Chana is an RN with a bachelor's in nursing, and she actually has experienced COVID, and will talk to us a little bit about that. So I'm going to hand it off to Dr. Sandock to begin to share his information with us.
Yeah, good evening. Thank you for joining us. I thought a good way to maybe kick this off is to give you some local flavor of what's happening in our county. So I asked Dr. Mark Fox, who's a deputy health officer, to supply me some information. He sent me a whole slide deck, and I went through some, and I want to go through some of the information with you just here as to start. Can everybody see my screen?
Yes.
Okay. Okay, so this is a summary as of just Friday afternoon in St. Joe County. To give you an idea, the population in St. Joe County is 271,826 people. Currently, we have 26 people in the hospital. The county is seeing 522 deaths. We're averaging 11,000 people per 100,000 residents. So in case you're looking at other places in the country, et cetera, this is our benchmark. The first people that have received the first dose of vaccine has been 50,000 in our county, and the fully vaccinated residents are right about 30,000. This is the demographic data, and I want to just point out a couple things. The people over 70 years old comprise just 9% of our population. Down here, these 22 to 29 are a lot of them college students, but only 9% are over 70 years old. This is a busy slide, and I'm just going to show you a couple of things. Here are the spikes in COVID cases going back from March of last year till March of this year. And you see that there was a spike, a big spike here in August, and another one in January and February in the 20 to 29-year-olds. These are basically kids coming back to South Bend, to Notre Dame and St. Mary's and other colleges. But you see that there's a general increase in all the cases in October and November, and you'll see that better in a few minutes. The demographics, 2/3 of our county is white, 12% Black, 8.3% Hispanics. Remember this 2/3 being white in a few minutes. Here's the fatality data. 80% of the deaths have come in people 70 and older. And remember, that only comprised 9% of our population. So 80% of the deaths came from that 9%. Again, you saw those spikes in October, November, December. That's when the vast majority of the deaths came in St. Joe County. And then it has been tapering off significantly since as people are getting vaccinated. The majority of the deaths came from from nursing homes. 57% of all the deaths in our county have come from nursing homes, and you can see that the blue is from nursing homes and other long-term facilities. Here is a little bit more simple graph that shows, again, this is every week, starting from March of 2020, all the way through March 7th of 2021. You'll see this blip in August when the kids came back. You'll see a blip here in January, but here's the big spike in October and November of COVID in our area. And this is hospitalizations. The hospitalizations just went through the roof in October and November. Remember, where 2/3 of our county was white? Well, the people that are vaccinated, almost 84% are white. We're having a real hard time getting the people of color, the Black and the Hispanic communities, to come in and get vaccinated, although that's lessening some a little bit. A busy slide. I want you just to look at two lines. This green line is all the people in our county that have had a second dose. So we're up to about 30,000 people that have fully vaccinated now. The yellow line is 50,000 people, and that's who've had at least one dose. So I just want to show you of our total county, we still have 75% of the people who are not vaccinated at all. And that's because they haven't really lowered the age until just recently. So for the people that are 60 years old and older, only 25% have not been vaccinated. So fully 3/4 of the people over 60 have been vaccinated. My one last slide, I just want to show you for the United States, we've had almost 30 million cases of COVID with over 535,000 deaths. You know, those are people, those are grandparents, those are people's mothers and fathers. The total vaccines given is over 100 million. 21% of the United States has had at least one dose. 11.3% are fully vaccinated. And I just want to point out how much more deadly the COVID is than influenza. So the influenza fatality rate is 0.1%, and the fatality rate for COVID is 3.1. Thank you. And we'll take questions on that, you know, during the question period.
Or Sandy. To share the screen.
Anna, do you want to?
Oh,
What do you
sorry, I
want?
had to take myself off mute.
Oh,
Oh,
go ahead.
okay. So a couple of things. I'm not ready for the slides quite yet. Dr. Sandock was kind enough to help me with that. So as was mentioned by Sandy, I've had COVID. It was a pretty miserable experience. My sister, Samara Gold, many of you may have heard of her because she worked at the Federation. She still has residual breathing problems from having COVID. And there was also a young woman who I grew up with in this community, in the Orthodox community, who many of us were praying for. She was pregnant, she was in the ICU, intubated. Thankfully, Baruch Hashem, she is home now recuperating. But it was a struggle. Many weeks of praying for her and finding out that she's finally there, finally home. I've also received the vaccine during the first rounds in December. I did get both shots of the Pfizer vaccine. I had some mild discomfort. I fatigued the first day afterwards, but thankfully I slept it off. We were good. A lot better than when I had COVID. I would take the side effects from the vaccine any day over having COVID. So if, Dr. Sandock, if you could put those slides up. The big question that I think comes up now is what now that we have the vaccine, that people have been vaccinated, what can we start doing? As the nurse who gave me the vaccine was saying, you know, I cried when I got my vaccine because I was so happy. I know another nurse I work with who cried when she made her appointment and she got her vaccine. And the big thing is, what the nurse who gave me the vaccine said is it's hope. It's hope for return to normalcy. Whether that's the normal we're all used to or a new normal is yet to be seen. But the CDC has some new recommendations as of March 9th, I believe it was. Is that slide coming up? Maybe. Okay, we'll talk about it. So basically, what can we do now that we have this vaccine, that people have been vaccinated? The big thing is people who have been vaccinated are fully vaccinated after 2 weeks after they've had the second dose of either the Pfizer or Moderna shot, or the 2 weeks after the Johnson & Johnson shot. That's full efficacy of the vaccine. At that point, the CDC is saying you can vaccinate, fully vaccinated people can be together in a room without masks on. I know for many people that's a welcome change. The other thing is people who have been vaccinated are able, per the CDC's most recent recommendations, to go see their grandparents. Even if they haven't been vaccinated yet, you can be in a room. Oh, see, there's a slide. We can probably be on the second slide now. This is the one that talks about how when the full effectiveness of medication is. Just be aware that, you know, you may have heard stories that people got COVID after they got the vaccine. If you're not in that full effectiveness period, it may not be effective yet. Okay, so back forward. For people who have been vaccinated, they can gather with another household of people without worrying about wearing masks. Now, if you have more than one household together, the risk who's not vaccinated, the risk isn't necessarily to you or from you, but those two units together could be a risk. And if you have been around somebody who has COVID-19, you do not necessarily have to be tested with the nasal swab. You can just watch for symptoms, and as long as you're symptom free, you don't need to quarantine and you don't have to be tested. So I think these are exciting things. I think a lot of people, especially with the mask fatigue, I think that's a good thing to look forward to. Obviously, I'm a huge proponent for the vaccine, and I'm a huge proponent for the fact that I get to go see my grandparents who have also both been vaccinated with the full series, and I actually get to be in the same room as them without masks on. So that's just my personal take on a lot of this. Okay. And then I think we're going to Dr. Sarnat.
Yes.
Okay.
You're muted, Bill.
Okay. I'm not exactly sure how to do this, so
You need to screen share.
where's the screen share? I got it. Okay.
Yes, Andy.
What did you do? Why did you?
Bill, you can screen share by going to the bottom of your screen and hovering over it, and you'll see a green thing that says screen share. You click on that and it'll show the rest of what's on your computer.
Yeah.
But you have to have that other one opened up.
Yeah, you need to open up what you want in the background. And as soon as you hit screen share, it'll show whatever's on your slides.
You know, and while he's doing that, you know, we're hoping that with the period of time when 70 or 80% of the people in our country get vaccinated, there'll be something called herd immunity, which doesn't really allow the virus to continue to replicate the way it did. And so then we can really start to open up the country. So you get herd immunity when people used to get polio shots or measles vaccines. Certainly not 100% of everybody got immunized, but really 80% is a good number.
It's not there. Screen is not there. All right. All right, well, let me just, are you muted? I can,
Unmuted, yeah. Muted.
So while we're waiting for Bill to figure that out, does one of you want to talk about the risks versus the benefits of the vaccine?
Turned it off, yeah.
Well, I mean, I can start, you know, and there has been no deaths in any of the 100 million people in our country that have been vaccinated. There's been no deaths from COVID. And as far as the last I heard, there's not even been a hospitalization. So it's a very effective vaccine. And it seems to be effective against most of the variants. The risks are really minimal. There are
Bill, I got it.
expected side effects. But again, when you hear about things like people getting paralysis and dying afterwards, there's been no discrete correlation between the vaccine and somebody dying. Because don't forget, in the age group that was getting vaccinated, people 70, 80, 90 years old, there are going to be people that die within the next month from strokes and heart attacks that aren't in any way related. So the benefits far outweigh any risks that there are to the vaccine, unless you happen to be really sensitive to a component. Okay, Bill, I see your.
yeah, sorry. Thanks for tap dancing while I tried to get back on the screen. I read today that 30% of Republicans are declining to take the COVID vaccine, and another 20% aren't sure, as opposed to 10% of Democrats. But there will never be herd immunity until we get at least a 70% of the population immunized. And so I was thinking that with this vaccine hesitancy, that we really should talk about what the side effects are from the vaccine. And
Bill,
yeah,
if you'll click on this thing up here that says slideshow,
all right.
way up on the top. No, left. Up on the top. Can you
Oh, yeah, okay.
click on that?
You show, okay.
There you go.
These are from the CDC, and some of the questions that we had as a preview last week, where people were concerned about the more serious side effects of the coronavirus vaccine. And this is a study of both, combination study of the mRNA vaccines from Pfizer and Moderna. I've heard about, will I get Bell's palsy? Bell's palsy is a facial nerve paralysis. And when you take a look at the number of people who get Bell's palsy in the general population spontaneously versus those who have been monitored 21 days after their last dose of vaccine, you can see that the numbers are almost identical, 20 and 21. I think this is per 100,000 people. We heard about Guillain-Barré syndrome. Guillain-Barré syndrome is a ascending paralysis that starts usually in the lower extremities and creeps up, and people end up on ventilators. Again, the incidence in the spontaneously this occurring in the general population is 1 per 100,000 and 0.6 for the vaccine. I won't go into Kawasaki's disease. What about strokes or hemorrhages? Again, in the spontaneous population, 8 per 100,000 versus 10. And transverse myelitis, that was the first thing we heard, I think, that halted vaccine for, I think, Moderna for a while, where somebody got a paralysis from transverse myelitis, which is usually fatal. And again, the numbers are pretty similar. And what about pulmonary emboli, blood clots to the lungs, or deep vein thrombosis of the lower extremities? Again, the numbers are similar. So in these probably 70,000 people who were monitored for this in the studies, there did not seem to be any terrible side effects that would make people feel that they were put at risk. The other thing, in the last week, I've been, I don't know why, but I've been called twice about whether pregnant women should be vaccinated. I actually got the slide from my niece, who's a gynecologic oncologist in Asheville, North Carolina, who's 4 months, who at the time was 4 months pregnant, and she got the coronavirus vaccine. And she was photographed having it on Twitter, and it was taken up by CNN, and she was interviewed, and they asked her why she took the vaccine, and she says, well, I think I know what the side effects from COVID are, and I've read about what the side effects from the vaccine are, so the risk-benefit ratio is in my favor for having the vaccine rather than not. So this is a summary of some of the data that's been collected by VSafe, which is a monitoring arm of, I believe, the CDC, which monitors the type of people who are getting vaccines. And you can see in the lower right-hand corner here that 30,000 women who have been vaccinated out of 55 million are pregnant. And the profile of these people, 50% were vaccinated in their first trimester, about 30% in their second trimester, and 19% in their third trimester. And most of them were vaccinated with Pfizer as opposed to Moderna. I assume that the women were vaccinated in their first trimester because at the time they probably didn't know what they were pregnant. So of the VSafe pregnancy participants, there were 1,800 who were enrolled in the study so far, and it's an ongoing registry. And what they saw they had, like, I think 225 women who actually delivered while they were monitoring, and that in the unvaccinated population, 26% of women had miscarriages at 26 weeks, as opposed to the 15% in the vaccinated group. Stillbirth was 0.6% in the unvaccinated group and 1% in the vaccinated group. And these are small numbers. There's only, I think, 275 women who actually delivered by the time this registry was written up. But you can see that almost all the complications for moms with gestational diabetes or hypertension, eclampsia, preeclampsia are really the same for both groups. And as far as preterm births go, it's the same for both studies, congenital abnormalities, small for gestational age, and neonatal death, 0%. So the bottom line is, so far it appears as if taking the vaccine is physically safe for people. The side effects are not different than the general population, and it appears to be pretty safe for vaccinated women. Yet the decision for a woman who's pregnant to get vaccinated is the decision she makes with the help of her doctor and perhaps clergy and others. But at least as of this writing, it seems to be safe for people to get it. I just wanted to make one additional remark with what the statistics that Mark had given, and that is that most people who die from COVID, 92% are over the age of 60. Most of the people who give the virus are people in 20 to 29 age group. So they're the pitchers, we're the catchers. And it just means that we're vaccinating the most vulnerable people, but we're not yet vaccinating the people who give it to everybody. So until that happens, there's still going to be vulnerable people around, and 40% of COVID COVID infections are asymptomatic, and 20% of people who transmit the disease are responsible for 80% of the transmissions. That's all.
And I'd also like to mention that now that Bill has shown that this is really safe in pregnancy, the flip side of that is that if you're pregnant and you get COVID, you know, the risks to you and the baby are really significant. So when you talk about risk versus benefits, it's tilted very much in favor of getting the vaccine.
Can you address getting the vaccine if you've already had COVID?
I guess I have two thoughts on that. One is that with the variants, there's a certain number of people who've had the vaccine, especially if they've had developed low antibodies to it, who are still at risk for reinfection. And especially with variants, not so much the UK variant, but the South African variant is still responsive, but not as much response to the Pfizer and the Moderna vaccines. And so it's possible that you could get reinfected with that. And so with variants coming out, I would definitely get the vaccination. Now, the people who've had coronavirus, I just read a paper yesterday or the day before, they really get a very robust antibody response after one vaccination. That's compared to a person who gets one vaccination, a single vaccination without having had the coronavirus. The people who have the coronavirus, their level of antibodies is about 30 times higher, 35 times higher than the people who are getting the first vaccination without the virus. After the second vaccination, it kind of levels off. The converse of that is that those people who have had the virus may expect more significant side effects with minor side effects like fever, muscle aches and pains, headache, fatigue after their first vaccination.
That they should still go ahead and get the second one?
Yeah, I would.
Yeah,
If they have a significant reaction to the first one with the fever, chills, whether they should get a second one, and that's being looked into.
the suggestion is if you've had COVID to wait 90 days to get your vaccine. And if you've had monoclonal antibodies, you should wait at least 30 days.
So how do you know if the vaccine you got is effective for you? Like, how do you know if you're in the 95%?
But according to the literature that I've seen, it doesn't really do you any good to check your antibody levels. So some people with low antibody levels are still seemingly fully protected. And there's no indication that you should check antibody levels after you get the vaccine. So Bill, or Hannah, unless you have some other information, I just think that you assume that you're as good as you're going to be.
Well, the other thing is that if you do get the virus, if you're one of the 5%, you're not going to die. You're not going to get a severe case. You're not going to be hospitalized. And so it's sort of like the flu vaccine. A lot of people take the flu vaccine and say, well, it's not 100% effective. It's only, well, last year it was only 50% or less, but you may not get as bad a case. So that's another reason to take it.
So when is your immunity level highest after you've been vaccinated?
If you take a look at the people who aren't vaccinated and those who are vaccinated, the incidence of the curves start splitting after about 12 to 14 days. And so that's when, after 14 days, the immunity starts picking up and the number of cases really goes down. So that's why they say 2 weeks after getting the vaccine, you can, your immunity is at a high enough level to protect you, but it still may go up some.
But will it go back down as time goes on?
It might, but the question is how much memory your immune system has, and nobody knows the answer to that. Is that if you get reinfected again, will you have memory cells like B lymphocytes or T cells that will spring into action and re-increase and pour out more antibodies to protect you again? And the answer to that isn't known yet because nobody's been vaccinated probably for longer than 9 months, I would guess. And that's why they're continuing to do the studies with Moderna and Pfizer to see how long, to see whether the vaccinated people start getting infected again.
So I've heard that Moderna is coming out with a booster shot that will address some of the variants. I imagine that Pfizer is working on something similar. If you've had one of those two vaccines and you need a new shot next year, do you have to stay with the same brand?
The answer is, I don't know, but I think that my unofficial opinion is that they will look and see what variants are predominant in the community or in the United States and give the vaccine that is specific for that variant. So whether it's the same vaccine that you had before or a different one, I think they will probably tailor your therapy to whatever vaccine will be most effective to the variant that's dominant in your community.
You know, the thing that's most exciting to me is 15 months ago, we didn't even know about COVID. And here we are with some excellent vaccines. And the way they make these things is by messenger RNA. And they're much more nimble now in order to be able to change those for the variants than they were making vaccines 20 or 30 years ago. So if they need to come up with a booster or an annual shot or whatever it is, and we're still way too early to be able to tell that yet, they're going to be nimble enough that they can hopefully change that mRNA to exactly what we need.
And they can change that mRNA within weeks. It's just a matter of production after that.
I have a question. Is there any medication available for people who have had COVID? I still suffer with respiratory issues, horrible muscle and joint pain, and I'm losing hair. I missed an entire month due to COVID. When will I be able to enjoy my life again?
Nobody knows the answer to that. And I sympathize with you since there's no real cure for COVID. There's not going to be much cure for side effects. But a couple things in the Washington Post this evening, my counsel, Dr. Mom, Diane, she showed me an article that said that some people who had the long hauler syndrome, when they got immunized, their symptoms went away. And I think that nobody's done a long study for that, but for those who are long haulers, or if you know somebody who's a long hauler, there's actually a support group called Survivor Corps. It's Survivor Corps, CORPS. And when they looked at with their statistics, they said that they surveyed their members, 216 people. They've, shoot, I just lost it. But like 171 felt no difference, 71 felt better, and another 50 felt no change. So it's really an individual, it's like you may be lucky, you may not. But so far, all we're doing is treating symptoms as best we can. My feeling is that there probably would be a good idea to have at least a support group in town so that people can talk to other folks who have similar symptoms, and if at least get some ideas of what makes them better, what makes them worse. At least you can talk to each other. I wrote a note to one of the CEOs of the hospital today, and I said, wouldn't it be nice to have a long haulers clinic in town? And he said, well, we'll see. We'll have to think about that. But I think if you're a long hauler or know somebody, see if you can form a support group.
And that is something the Federation could offer, at least for our people, at least until something gets going through a clinic or hospital. I can look into that. There's a question in the chat. When can the synagogue open up again? One medical professional, this is from Rabbi Friedland, one medical professional told me 50 or more in the sanctuary with masks, but another said no more than 15 until the end of the summer.
Well, I think some of those numbers are going to depend on how many are vaccinated. Okay, so if you had 20 people, all who are vaccinated and could be reasonably distanced, I think you would be in pretty good shape. If you had some of those folks that were not vaccinated, I think we're so close to the finish line. The light is getting much brighter at the end of the tunnel, and I think holding back a little bit is prudent. But I think it would depend on the majority of those people or all of them being vaccinated first.
Right. And one of the things that I'm looking at is the CDC's recommendation in terms of what hasn't changed, even if you've been fully vaccinated, is that you should avoid medium or large sized gatherings. Now, how you define that obviously varies.
I think the bottom line is nobody knows. And, if you think that if you look at the positivity rate in St. Joe County, it's 3%. So that means of 100 people that you might meet spontaneously, 3 might have the virus. So the bigger the number of the groups you have, the greater the chance that there'll be somebody there who's actively infected. The other thing is that viruses, the more they're transmitted, the more they can develop variants. And so, and the variants are what's going to make our lives miserable until we can control this thing, or at least make it so that we know how to avoid it. So my feeling would be to err on the side of caution.
There's a question, has anyone gathered any statistics on COVID vaccinations in the Jewish community, is there anyone reaching out to those who haven't gotten vaccinated and are eligible? That is actually, you know, part of the reason we were having this educational program. There is a vaccination hesitancy program that was put out by the network of Jewish Human Service Agencies. And it is the kind of the more orthodox the group, the less likely they are to be vaccinated. And also, though, those same groups are the most likely to experience knowing someone who's ill or having experienced a death in their family. I have another question about given for individuals who have had COVID, is the J&J vaccine a good alternative for people who have had COVID?
I haven't read any specific recommendations other than to say if you've had COVID, then wait 90 days and take whatever vaccine's available to you. If it's J&J, Moderna, or Pfizer, it would be what I think.
I did have somebody that I was talking to at work who said they'd be interested in the vaccine, but they weren't sure which one to get. And they also told me that they don't do well with follow through. I said, well, in your case, if you had an option, probably go with the one-shot special instead of the two, because you're not going to get your full effectiveness if you only get one of the series.
And Notre Dame is going to vaccinate 4,000 people on what, March 25th and 6th,
6th and 7th.
or 26th and 27th, and they're using the J&J vaccine.
One of the nice things about when you go get your vaccine is that you don't leave that facility without an appointment for your second one. So it's not something that you got to go back and register for and figure out. You leave that facility and you know that on April the 14th at 4 o'clock in the afternoon, I'm going to get my vaccine.
And I think that's an Indiana thing, because I know I've talked to people in other states who have had to make appointments at a later date. I have a question about gathering with family. What about someone who has an infant? Is it safe for the infant?
Well, it was like the CDC was saying, as long as there's nobody at specific risk. So I guess that would be a conversation you'd have to have with your doctor or pediatrician.
Regarding the parent of the
Yes.
child should see if it's safe for the grandparents or great grandparents to visit them.
Right. That's what I would imagine. But Dr. Sandock, Dr. Sarnat, you have anything else maybe?
No, not specifically, unless that child had respiratory problems or was maybe very premature, or, you know, so if they got COVID, even a mild case, it would be a catastrophe. So, you know, a healthy infant, I guess you could check with your pediatrician.
I think you have to consider an infant, I mean, as high risk, don't you think? So,
I don't know what, yeah, 30 days, I don't know.
yeah. So if they're high risk, then you probably could go, but I'd wear a mask around them.
And I would encourage people like Galana or anybody else that's on here, if they have any special knowledge about this, to chime in.
Yeah. Alana, do you want to put in your 2 cents?
I don't really have any specific information about infants and being exposed to COVID. They seem to be hardier than people who are older. I'm not aware of any infants who have died of COVID exposure. I have delivered several babies to moms who tested positive in labor. They're not being separated at birth. The moms are continuing to breastfeed and are just trying to limit exposure when not breastfeeding. So I would counsel my patients, and I have counseled my patients who were positive in labor, to just limit exposure when you're not breastfeeding, limit exposure to the baby, but there doesn't seem to be as severe repercussions to a newborn as there are for older ages.
So Samara says that she wants to add that her pediatrician advised that children who had respiratory issues when younger are at higher risk for more severe COVID even
Mhm.
years later. So that's something to keep in mind. So I'd like to open it up to anybody who has any questions. You can raise your hand and I can call on you to unmute. Audrey?
You're muted, Rodri.
Okay. I was in the hospital with COVID for 8 days. My husband, Dave, for 22 days. And so we're still experiencing side effects, but I had the vaccine 2 weeks ago and I have a permanent pounding headache that won't go away. And I've had really bad dizziness to the point where I went down on the ground. I fell, I just lost balance. It was for a few days, but then I went to reach for the door and I just totally went, I think I fainted for a minute. I don't know. It was like very scary. But do you think I want to have my second vaccine on March 25th that's coming up? I'm like kind of scared. I don't know, I don't know what I should be doing.
You recovered from the first one?
Well, but
Okay, and then when you had your COVID, how were your symptoms between the first injection and the COVID? Did you recover completely from that, or did you have some residual?
Well, I've had some residual, but it's been over 90 days. And so the doctor said I should take it when I can get it, when it's my age group. So I went and got it. But they say the second vaccine is worse than the first. So if I'm going to get much more side effects, I really don't want to do the second vaccine right now. I don't know what to do.
I don't have a lot of experience with that, but the people that have had COVID and had a significant reaction to the first one, that may be somewhat muted with the second one, because you may already then have had the big boost in your antibodies and your physiologic response to the first vaccine, and may not at all be worse than the second. Maybe somebody has more experience after 2 of them.
I think anecdotally, I've heard the same thing that Mark just said, Audrey. And even if you have a very big response to the first vaccine, the second, there's some information, there's some people saying that if you've had COVID, you only need one of the 2 vaccines, that you should be equally as covered. And there's data to support that the level of antibodies after a single vaccine is high enough that you may not need that second vaccine. But even so, if you do take the second dose that's available to you and boost your immunity by a few % more, you are unlikely to have a big immune reaction to it.
And if you listen to Dr. Fauci, he bases everything on science. So our science of these vaccines is a full 2-dose course of the Pfizer and the Moderna. And if you go off that, there's not that much data to support it.
Right. And I'd also like to mention, I did have COVID. I had both Pfizer vaccines. The first one was actually worse for me, the side effects, than the second one.
Okay.
And I think that we're hearing that a lot.
Yeah.
And I know that's anecdotal, but that's my story.
But it is probably because you have a bigger immune response after the first one. And the second one is just sort of icing on the cake in the situation where you've had COVID already.
And another question I have too is, I recently had an echocardiogram. and my husband's going for a test for, what is it? Pulmonary fibrosis. And so what tests do like post-COVID people have to keep taking to find out what's going on inside of them? Like how the damage is. I mean, how long down the road, am I a long hauler already? I don't know. But you know, I don't know, how many tests do we have to take?
Can I jump in a little?
Yeah.
Go ahead.
Is that okay?
Yeah, go ahead, Samara.
I just wanted to address some of that stuff. I want to first go back to what you had mentioned about the vaccines and just say that as somebody who also had COVID, probably twice, I probably had it in the last 12 months. The first time at the very beginning when they weren't testing, but I did spend time in the hospital. When I had my vaccine, the first one was not so bad for me, and the second one was not so bad either. But I actually was one of those people who felt significantly improved after getting my second vaccine. It was probably the best 2 weeks I've had in like the last 5 months in terms of breathing and my energy level and everything. So again, anecdotal, it's not scientific, but that was my personal experience. So I hope that gives a little bit of encouragement for you to, follow through, because that's the science we do know. And it's definitely not worse than COVID. And also just kind of a side point addressing the possibility of a support group and, kind of a community of long haulers to talk. I have a lot more to add that's not right for this particular meeting, but there is a lot of testing and stuff and not necessarily available locally entirely for COVID and for long haulers. But I'd definitely be happy to participate in that and speak to you more after this to facilitate some of that information and help with that.
Thank you.
All right, I'll follow up with you on that, Samara. Sarah Ann, you had a question?
Well, a question or a comment. Thank goodness I have not had COVID. The first vaccine, my arm hurt a little bit, but like a flu shot. I mean, it didn't keep me from doing anything. The second vaccine, I don't think I had any problems. Does that mean I don't have the benefit of being fully protected because I had mild or no, reactions? Or can I be confident that, yes, I'm protected?
When you have these vaccines, they want to stimulate an immune response. And, these like the mRNA vaccines the mRNA is delivered in a fat globule of polyethylene glycol. And that, that will elicit immune response as well. The J&J vaccine is the vehicle to deliver the DNA, and that vaccine is an adenovirus 26, and that will stimulate an immune response or fever, muscle aches, and pains. And so just because you didn't get those side effects doesn't mean you didn't get an antibody or a protective response, because you may just be, you could be responding to the mRNA, you could be responding to the stuff it's wrapped in. So you can't tell, but they deliberately give you the vehicle, like in the J&J, they want you to get an immune response to prime your own. So they wrap it in a virus, and the same with the polyethylene glycol for the mRNA vaccines.
And I think we need to
Thank you.
remember and take comfort in the fact that when they were doing these trials, okay, they came up with 95% effectiveness, and a huge percentage of those people didn't have any symptoms whatsoever. They didn't get fever or headaches, or they didn't have significant side effects. They might have had a sore arm, they might not have felt particularly well, but the level of their side effects did not seem to correlate, because they still had 95%, or they would never have come up with that kind of a number.
Oh, okay. Thank you. Thank you both.
I have a request for in the chat for the panel to review the CDC recommendations for gathering, especially for kind of people who have had vaccination and people who haven't.
Do you want me to put that slide back up? Hannah?
Yes, yes, please.
Let's see here, right here. Can you see this?
Can see,
We see that you're
Okay.
sharing your screen, but we don't see anything on the screen.
Okay, hold on a second. No, you
There we go.
Yeah.
there you go. Okay,
Oops.
there. Is this the one you want?
Yes, that looks good.
So basically, if you've been, as the slide says, you know, and CDC say, if you're talking to fully vaccinated people or 3 fully vaccinated people, they can be together indoors without wearing a mask. The same, we still talk about if you're outside 6 feet apart, you don't necessarily have to wear a mask, even if you haven't been vaccinated, maintaining social distancing, but it is better. So the difference between that and the vaccinated people is that they don't have to wear the masks when they're together. Which I know for a lot of people, a lot of the complaints I get from patients are their coworkers. This mask is uncomfortable. I can't breathe with it on. It's itchy. So this is a game changer kind of in that regards to social distancing.
You know, and I think when somebody asked about opening up the synagogue, for instance, you know, if you knew that 10 people were all vaccinated and they made dominion, you would be, in my opinion, pretty safe to be able to do that in a small group like that if everybody had been vaccinated.
I don't think that Rabbi Friedland's question was regarding people unmasked, though. His question was how many people can be in the synagogue, for instance, for a bar mitzvah, masked. And the question really, the answer has 2 parts. How many of those people are vaccinated and how many are not? Would you feel comfortable with 50 people in the synagogue, all of whom have been vaccinated and are wearing masks? I would.
I would.
Would you feel comfortable? Yeah, would you feel comfortable with 50 people in the synagogue, 40 of whom are adults who have been vaccinated, and 10 of whom are children, family members of those adults who are in their same households, who the children have not been vaccinated, and all of them are wearing masks? I would.
I would say you would still need to maintain some social distancing between those
And
children.
maintaining social distancing so that in that big sanctuary, this is how I envisioned it, was you could spread 50 people around and just have everybody separated into family groups, all masked. And the only people sitting next to each other are people who are living together. And otherwise you are 10 feet away. The sanctuary is big enough that you could do that and wear masks. I would feel comfortable with that. And that, I think that's really, you know, different than, nobody's assuming that anyone's going to be in the sanctuary unmasked. And, you know, now that people are vaccinated, I think you could put a requirement that you're not allowed in as an adult unless you have been vaccinated.
show your card.
And show your, I mean, it's only a matter of time. I mean, I don't know if any of you were on the call with Leah Lahavi on Sunday, but she actually showed us on her phone, you know, the former shlicha, she has an ID, a QR code on her phone that documents both of her vaccine doses. And she is required to show that if she wants to go inside a restaurant or a bar or any store in Israel. She's stopped at the door. Her phone is scanned. She shows her ID to show that she's not faking it, that she is actually the person that's on the QR code. And then they let her in. And if you don't have that on your phone, you can't go inside a business in Israel and you can't go inside a restaurant. You can eat outside the restaurant You know, you can sit outside a bar and be served, but you cannot go indoors. So I don't think it's too much to ask to say that we are only going to let people, now that the vaccine is widely available, we are not going to let people inside the synagogue, even masked, unless they have been vaccinated. I'm not going to be the policeman at the door asking people to prove that they're vaccinated. I'm going to trust people from my congregation when they say they've been vaccinated. But I think that's not too much to ask. And if we can do that, then I think we could have 50 people in the synagogue.
Okay. I
Sally?
have a-
Yeah, my question has to do with how comfortable are the medical professionals with people who are vaccinated eating inside of restaurants?
I'll go first. I am not yet, because I'm gonna assume that there's a whole lot of people that are not vaccinated. They don't have their masks on. I'm not sure exactly about their ventilation system. So, you know, I made my sole exception in a year last week when we stopped at a restaurant to take food out, and we were because it was between lunch and dinner, there was nobody else in that restaurant, and all the workers were masked. So I said to Susan, well, let's eat here, but I would not go into a restaurant crowded today. Maybe
I agree. I wish my children felt the same way.
I wouldn't go to a movie theater.
Agree. Thank you. Bill, do you agree?
Yeah, I wouldn't.
Good.
I have a question regarding what Ilana said about the synagogue. Eliana's bat mitzvah is scheduled for May 22nd, a year later than the original date. And in my family, Aviva's been inoculated, or she had her first one today. Ian had a first one last week. Larry had a first shot. I've had both shots. But Jessica's under 50. She hasn't had any shots. Jonah is 5 and Eliana's 14. And Leora is going to be 19 by then. So some of us have had shots and some haven't. So how could we possibly have her bat mitzvah in the synagogue? I mean, I have trouble. Can the children wear masks and my daughter-in-law wear a mask? And
Your daughter-in-law will be vaccinated by the time of the bat mitzvah, Sarah Ann. The children can wear masks the entire time, and they will. There has already been a bar mitzvah at Sinai in November, and everybody was masked, and there were only 20 people in the entire sanctuary the whole time. Everybody was masked, including the children.
okay,
So
thank you.
that will go on.
Thank you. Thank you.
Nancy, you have your hand up?
Yeah, can you hear me?
Yes.
Now you can't. Now she's
Well,
muted.
now I can't, but before I could.
How about now? Can you hear me now?
Yes.
Okay. I was in the temple office and 6 people randomly all came in at the same time, and all of them had shots and they all had on masks. But forget about the mask for a minute. They said, oh, you don't have to worry, Nancy, because we've all been vaccinated. Is that true? I mean, am I not still at risk from them?
You are still.
Even though they're vaccinated? I'm sorry?
I'll answer that. Yes, if you have not been vaccinated, you are still at risk. And for instance, I've been fully vaccinated, and yet every day that I'm in my office, I continue to wear my mask all day long around all of my staff, most of whom have been vaccinated, and with all of my patients who are also masked. The reason is I have a son at home. Well, first of all, I have a 5% chance of getting sick, and I don't care if it's not a severe sickness that's going to end up sending me to the hospital. I don't even want a mild sickness. Why do I want to get sick? I'll continue to wear the mask. Second of all, I have a son at home who is not eligible for the vaccine yet. And I can be in that 5% that gets mildly sick, come home and give my son a severe sickness. I can be a carrier. So just because you've been vaccinated doesn't mean you can't be in the 5% of people who still get mildly sick, but then become a carrier to somebody that's unvaccinated who can get a severe sickness. So those 6 people that came in and said, don't worry, we've all been vaccinated, you better believe they should be wearing masks, because you do still need to protect yourself.
Thank you. That's the answer I was looking for. Thank you.
That was a good question, Nancy.
Thank you.
And another thing, I just want to vent a little bit. I'm so tired of hearing about, I don't know who said this, Chana or Samara, about people complaining about they have mask fatigue. I have no sympathy. I wear a mask all day long, all day, sometimes 12 hours or more in a day. And for people to say they have mask fatigue, I don't want to hear it. Put a mask
Dr.
on.
Kirsch, I
Protect
agree.
people around you.
I have difficulty breathing every single day since I've had COVID, and I still go an entire workday, 8 or more hours as necessary in an N95. It is completely manageable. Like anything, you just have to get used to it. You have to find the right mask that fits you correctly. And if your mask isn't comfortable, it's not the right mask for you. And it just needs to be done. And as somebody who still masks, is fully vaccinated, and still suffers, it is so critical.
Yeah.
And to amplify what Alana said is, you can be infected but not have the disease. That is, you can still have a viable virus in your nose and mouth and be able to transmit it, but you yourself don't have the disease. It's sort of like typhoid Mary, you know, she didn't have typhoid fever, but she was a carrier. And so right now, there's no solid information about whether vaccinated people aren't carriers. And so that's why we still should wear masks.
Thank you all.
Are there any other questions? Abe.
My question is, how do I know if I'm protected? I have had a liver transplant. I'm on on immunosuppressants, and I was one of those fools that had the antibody test, COVID total antibody test that showed no antibodies. And so how do I know if I'm protected? I had the 2 vaccines, the last one, January 22nd.
Last one is January 22nd, so that's 2 months.
95% chances.
Yeah, I don't know the answer to that Abe, except there's more than one type of immunity. We're looking at antibody immunity, but there's also T cell and B cell immunity. I think your immunosuppressant drugs may affect that as well. So I don't know the answer to that.
Is there anybody doing research or statistics on how the vaccination works in people who are taking immunosuppressant drugs? I mean, that's a whole lot of people.
Yeah. No. I think that they're looking at that, but I don't know the answer to what the results are.
Well, maybe we'll get a little information on Thursday, because Abe and I are going on a Zoom meeting from Northwestern with their immunologists and their infectious disease people who are specifically talking about COVID and people who are immunosuppressed. So maybe we'll get some information and we can pass that on.
So if you would pass on any information to me, I can send it out to people from Jewish Family Services.
Okay. Thank you.
I see there was a chat about opening up to people under 30. I don't think we can really predict the timetable for the state opening up. Because when I was given vaccines last week, they told me, and these are people from the know, that they were probably not going to stop at 45. They were going to go from 50 to 40. And then they stutter step to 45. And I don't know how quickly. I know the president has hoped that everybody by May 1st is going to be eligible. I know in Michigan, anybody's eligible now, but I don't know how about being able to predict Indiana's timetable.
I will just say, you know, we are so far ahead of some other places. I have friends in Amsterdam who they're just starting, they're just doing people above 8. And some of the European countries are really struggling right now. Italy and France are shut down again. I heard Germany's about to shut down again. And they've had very little vaccination distribution. So we're pretty far ahead of the game that way, although not as far as Israel. If there are no more questions, I'll draw us to a close, but with a really heartfelt gratitude to our panel.
I'd like to make an observation. Not one person do I see right now wearing a mask.
We're all home.
We all home?
We're all home.
Okay. But no one's wearing a mask.
Hugh will keep our boxes further apart the next time we have a Zoom meeting.
Okay.
So a big thank you to Dr. Sandock, Dr. Sarnat, Chana, Blatt, and Smargold, who helped behind the scenes, and Alana Kirsch, who gave me ideas for who to contact in the first place. So I'm very appreciative to everybody, and you know, I think part of the message for those who are at higher risk due to like immune problems is that we just still have to stay the course. You know, wear masks, social distance, wash our hands, and stay away from other people, especially in groups. So,
Thank you.
Thank
Sandy.
you.
so anyway, thank you all very much for
Yeah.
coming, and
Thank you.
Well, thank you for making this program. It was most worthwhile.
Thank you,
Thank
Hugh.
so much. It was a lot of useful information that I will share with the whole Russian community who could not be here today, and I will be their voice and explain everything that I've learned today. So thank you so much.
Gina.
It was very, very useful.
Gina, we can help people with rides.
Thank
If
you.
need rides to appointments, you know, we can schedule that.
Sure. It's nice to know. Thank you, Sandy.
Yeah, and I saw in the chat a thank you also from Moshe, who I know got his first shot today. Ooh.
Ooh.
Sally, did you have something? No. All right, well then I'm gonna say goodbye to everybody, and thank you all for participating. And if I hear more information from the team, I will pass it forward to everybody.
Thank you.
Thank you very much.
Thank you.